Most candidates look at this question, do a quick calculation, and will confidently mark the wrong answer. They have no idea they just walked into a trap. This vignette looks simple, but it will test a specific Australian Medical Council guideline nuance that is almost always misunderstood. Welcome back to AMC Decoded High Yield MCQ series. Today, we are continuing with question number 9. Let's see if you can spot what everyone else misses. Here is the case of a 30-year-old male who presents to his GP with anxiety regarding his family history of cancer. He is currently asymptomatic, reporting no weight loss, change in bowel habits, or rectal bleeding. On examination, he is a well-appearing male and no pallor or jaundice. His vital signs are stable with a blood pressure of 124/76, heart rate of 74, an RR of 14, temperature of 36.7, and a BMI of 24. On examination, his abdomen is soft, non-tender, and non-distended with no palpable masses or organomegaly, and normal bowel sounds are present. He has the following family history. Father is diagnosed with colorectal cancer at the age of 58. Brother is diagnosed with the colorectal cancer at the age of 55. And his uncle is diagnosed with colorectal cancer at the age of 42. What is the correct colonoscopy screening plan for this patient? A. Colonoscopy starting at the age of 32. B. Colonoscopy starting at the age of 40. C. Colonoscopy starting at the age of 45. D. Colonoscopy starting at the age of 48. E. Colonoscopy starting at the age of 50. I want you to lock in your answers. The correct answer is B. Colonoscopy starting at the age of 40. Let's try to decode this. To solve this, we need to deep dive into this flowchart because this is where the decision making actually happens. The guideline divide patients into 3 lanes. Lane 1 is average or slightly increased risk. Lane 2 is moderately increased risk, and lane 3 is potentially higher risk. Now, for lane 1, average risk, this is the general population aged 45 to 74 with no symptoms. For them, we use IFOBT or immunochemical fecal occult blood test every 2 years, starting from age 45 to 74. We generally do not jump straight to colonoscopy here because the risks of perforation and bleeding outweighs the benefits. Lane 2 is moderately increased risk. This is where you have some family history, such as one FDR or one first degree relative diagnosed before age of 60, one first degree relative plus one or more second degree relative, or two first degree relatives at any age. Once you hit this lane, the game changes. The test becomes colonoscopy every 5 years, starting at the age of 50 or 10 years younger than the earliest FDR diagnosis, or whichever comes first. And we will continue it up to age of 74. Lane 3, potentially high risk with Lynch syndrome excluded. This is where our patient lands. Look at the criteria carefully. 2 first degree relatives plus 1 second degree relative diagnosed before age of 50. 2 first degree relatives plus more than or equal to 2 second degree relatives, or more than equal to 3 first degree relatives at any age. For them, we do colonoscopy every 5 years, starting at the age of 40 rather than 50, or 10 years younger than the earliest FDR diagnosis, or whichever comes first. And we will continue it up to the age of 74. Because our patient fits this specific high risk criteria, his floor age drops in category 2. The floor age is 50. But in category 3, the floor age drops to age of 40. This is why identifying the correct lane is critical. The 10-year difference is the difference between a correct diagnosis and a missed cancer. Let's break this down visually to expose the traps. Step 1. We have 2 first degree relatives, father and the brother, and 1 second degree relative, that is the uncle, who is diagnosed before the age of 50. Does at least one refer only to the first degree relative? No, it refers to the whole group. Because the uncle was 42, he triggers the rule. He's the trigger that pushes the patient into high risk category of category 3. Now, step 3 for the start age. And the rule says starts 10 years younger than the diagnosis in the first degree relative. You cannot use the uncle's age here. You must look at the timeline of first degree relative. The earliest first degree relative is the brother at the age of 55. So let's look at why most of the people feel this question. Option A, colonoscopy starting at the age of 32. This is the uncle trap. You calculated 10 years prior to the uncle. That means 42 minus 10. That is forbidden. The Australian guidelines explicitly say to calculate based on the first degree relative only. Option number C, age of 45. Now, this one is tricky. You did the math right. Brother's age is 55 and you minus it with 10, which will give you 45. But you forgot the guidelines law. In category 3, the rule says 10 years prior to the first degree relative or age 40, whichever is earlier. Since 40 is earlier than 45, the correct answer would be B, colonoscopy starting at the age of 40. Option number E. You picked this if you ignored the uncle entirely and thought this was only category 2. Now, here is your cheat sheet to master this question. Count the FDRs or first degree relatives first. You need at least 2 FDRs to even consider for category 3. The second one is a young second degree relative can trigger the high risk category. And the third is always do your math on the first degree relative and always calculate minus 10 years from FDR and not TR. If this video saved your mark on your exam, hit that like button, subscribe for more high yield AMC breakdowns.